Thank you very much, and a good morning to you, Desiree, and to your viewers. Well, we know that upon arrival, the Deputy President is going to go to the Civic Center where he's actually going to be briefed about what is expected to unfold here today. As you rightfully mentioned in your intro, that we are commemorating World TB Day. And we know that they are also launching the National Strategic Plan on STI, TBs, and sexually transmitted diseases. So what this means is that from this year up until 2028, they're actually going to implement this particular strategic plan that's going to try to conscientize people that they need to take their medication and avoid a situation where drug-resistant TB comes up if the medication is not actually taken care of. And we know that behind where we are here at the Tlhabane Sports Ground, there is an informal settlement where the Deputy President is going to go there to engage the community there and to sort of conscientize them about the risks of knowing whether their TB is well taken care of or otherwise. And we also know that there is a Agenda 2030 which is actually coming. It's going to come shortly after the end of this particular National Strategic Plan on HIV and STIs and TB that's actually being launched today. And what this means is that, Agenda 2030, that's when the world leaders decided that's when they're actually going to end the scourge of HIV and AIDS. So that's what we're going to interrogate actually today, to try and find out as to what were the shortfalls of the previous national strategic plans. This one that's being launched today is the 5th national strategic plan that the Deputy President, as the chairperson of SANAC, which is the South African National AIDS Council, is going to be rolling out. We're going to try and find out what has been the shortfalls in terms of the previous national strategic plans, whereas we are reaching a stage where 2030 is knocking at our door, but HIV, AIDS and TB are still a scourge that's actually challenging South Africa. And we know that South Africa is actually one of the countries that are badly affected by this particular scourge, due to the fact that some patients would actually just disappear from the system without having completed their medication, and that actually leads to complications such as the drug-resistant TB. So these are the issues that we'll actually be tackling with. We know that there are some stakeholders that are actually going to be here, people like SANAC, people like the funders that actually ensure that government's program on HIV/AIDS is effective. So we're actually going to try and engage all those people today while the program will actually be rolling out. It's an extensive program that's actually going to end at around 2:30 today, where there's speakers that have been lined up. We know that stakeholders like the WHO, SANAC, the Department of Health, and different stakeholders are actually going to be here engaging on ways to try and end this particular scourge of TB. We know that as late as 2021, there were about 120,000 people that actually died in South Africa due to TB. And this actually baffles a lot of people, as TB can be cured. If people actually stick to their medication for the duration that has been put down, that is about 6 months, then the person is able to come out of TB a new person. But up until today, there are still reports of stigma, where people are now stigmatized when they have TB, where some will say, no, if you have TB, then it means that you also have a certain sexually transmitted disease or HIV, because the symptoms of TB are almost similar to those of HIV, where if people are not treated and they are not getting their medication, they actually lose weight and they have to go for treatment. So there's that stigma that is one of the challenges that's actually hampering progress in terms of ensuring that we win the fight against this particular issue of TB, HIV, and different other HTIs. So people are actually interested in this national strategic plan to try and find out as to whether it will be feasible enough to ensure that, we meet the Agenda 2030, whereby world leaders have set a target where they are saying that they're going to end HIV and AIDS by then, Desiree.